The National Primary Healthcare Development Agency has developed this video to provide clear and concise guidance on the electronic registration process for all priority groups for adequate planning and implementation of activities towards achieving herd immunity for COVID-19. Accurate planning for life-saving vaccines will only be possible if the right data is gotten and used to plan for the equitable distribution and administration of vaccines to protect our most vulnerable population to avoid unnecessary morbidity and mortality of Nigerians. This video provides a step-by-step guide for electronic registration and how to get help when needed. Always remember to abide by all guidelines by the Nigeria Centers for Disease Control to avoid contracting COVID-19 and keeping yourself and your loved ones safe and protected. There are 3 processes by which the data will be captured by the e-registration process. For health workers, self-registration using the following URL: assisted registration through M&E officers or LIO of the LGA where you work. For other priority groups and rest of population, house-to-house enumeration exercise which will be conducted by teams visiting homes to collect data for other priority groups. There are 4 priority groups targeted in the first phase of COVID-19 vaccines introduction in Nigeria as follows. Priority 1. Frontline workers, health workers, auxiliary and support staff including cleaners, drivers. Priority 2. People 50 years and above. Priority 3. People below 50 years with significant comorbidities. Priority 4. Other risk groups based on disease burden. Enumerators will be visiting each eligible household to collect relevant information on address, name, phone number, and to help allocate time, date, and venue for your vaccination. Based on vaccination sites identified, each registered beneficiary will be scheduled for vaccination in a site or facility in phased approach using the priority groupings for most at-risk population. SMS reminders or phone calls will be used to inform beneficiaries on vaccination time, date, and venue. Clients are encouraged to be present at time and date given for seamless vaccination. Vaccination teams, LGA, LIO, M&E officers or state team will be available to support beneficiaries for rescheduling within the campaign period. On the day of your appointment, beneficiaries visit assigned vaccination venue on time for screening and verification by a recorder who will confirm name on the line list and check ID card or any evidence including a driver's license, voter's card, national ID number, NIN, international passport, etc. Following successful verification, they will be vaccinated, tallied, and issued a vaccination card to come with on your next appointment date. They will be tallied as vaccinated on the e-register and scheduled for the second dose. They will also be observed for 15 to 30 minutes after vaccination. Follow-up will be done through phone call, email, or SMS, and encouraged to report any effect they may feel for continuous monitoring. This message is brought to you by the National Primary Healthcare Development Agency, NPHCDA.